Today we are talking about the Parkinson disease, which is one of the types of movement disorders. So the Parkinson disease basically affects the patient's mobility, and there are sometimes undesirable movements like shaking of the hands, awkward movements of hands, face, neck, and legs to the entire body, and there is a stiffness of the entire hands and legs. So the affected person is not able to walk and not able to pursue his normal life. So that's when they come to the attention of the doctor, and quite often once they are diagnosed, they are started on a drug called Syndopa. Syndopa is one of the very effective medication for Parkinson disease. But as like any other medication, like it only works for a certain period of time, generally 3 to 4 years. Like that's when patients start requiring more and more doses of Syndopa and start developing side effects. That's when the surgical option is something which is suggested, and that is called the deep brain stimulation surgery. The deep brain stimulation surgery is not like any other brain surgery. It's one of the most minimally invasive brain surgery that is done. And it's very safe surgery and very less risky. 2 electrodes are implanted in the brain after a thorough planning that is done based on the MRI, CT scan, and on the computer software planning. Then there are 2 small wires which run on the underneath the skin, and there's a small battery that is implanted over the chest. So that's when this gives an excellent symptomatic improvement for the patient. And patients after 4 to 5 years, whenever they go for this after the surgery, like there's always an excellent quality of life. Patient from driving, doing regular activities, some of the games and sports, to lot other improvement in the quality of life that is observed for the patients. The deep brain stimulation surgery has been there world over. It was being done for the past 25 years, and this is something like which is a very safer surgery, and it's probably the most minimally invasive neurosurgical procedures that we do. And we have overall like experience of doing hundreds of these cases, and they absolutely the results are fantastic. Patients enjoy a very good quality of life, and they go back to their work, they drive, they do almost most of the activities of daily living which they were doing before this disease affected them. So the current technologies which are available in the deep brain stimulation are the ones which can sense the brain activity and deliver pulses to the brain, which rather gives even far more better symptomatic relief than what they used to get with the earlier devices. So I suggest strongly that the people who have the Parkinson disease should consider this surgical option strongly, and say yes to DBS.
Say yes to DBS.